Consultant physician and infectious disease specialist, Dr. Getty Chimeka Ayawuke, joins me on the news from Louisiana via Skype. Good to have you join us, Dr. Ayawuke.
It's my pleasure to be here. Thank you for having me.
So if you listened to what the Director General of the WHO there, he did say correctly that governments have a responsibility to protect their people from the COVID-19 pandemic by administering the vaccine. And we see how a lot of governments now want to give booster shots because of the Delta variant. So, but low-income countries are also left behind. So how fair is that statement that there should be a moratorium on booster doses?
To be candid, I think it is a fair statement because once the vaccines became available, the World Health Organization had a very minimum baseline for all countries of the world. And that baseline was that every country, including the poor countries, should have vaccinated about 10% of their population by September of 2021. And here we are. A lot of the poorer countries haven't even vaccinated maybe 1%, 2% of their populations. And we have other countries that are giving third doses. I understand, like everybody else, why they have to protect their most vulnerable citizens, like Israel. And I believe France and Germany are saying they want to do the same thing. The United States and United Kingdom are, monitoring the situation. But it is only fair to let the poorer nations get some vaccines into their own vulnerable populations before we start giving the third doses. And we understand the concern because the fall, we are in summer, way into summer. The fall is going to be here soon, and the winter is going to be here soon.
And
so
Dr. Ayawuke,
about those populations.
That's exactly where I was going, because we understand the principle of fairness and equity. But there is also the fear that if you do not give the booster doses, especially with this Delta variant, that these countries might begin to see more hospitalizations. And so doesn't that defeat the purpose of vaccination in the first place in these countries?
There are multifactorial issues here. So let's back off a little bit. The virus needs human beings to propagate itself. So what we need to do is to stop the virus. We know we cannot stop the virus entirely, but can we slow it down? If the rest of the world is not getting vaccines, the world is now a global village. So if Nigeria is not getting enough vaccines, you will have the virus there, and the virus in changing, because it's such a simple organism, in changing, it mutates. That mutation might end up being consequential. And it might end up being worse than what we have right now, such that the vaccines may not even work if the virus becomes that consequential. And that's the crux of the matter. So we need to be able to slow this down everywhere else. It's not like if you vaccinate all the people in the northern hemisphere, you will not have this virus come over there again if you have a very superior mutation. So we have to look at all the issues here.
So if I get you correctly, it's basically simple. Americans are not safe until Nigerians are vaccinated. Germans are not safe until Indians are vaccinated. Everyone has to be vaccinated for, at least to an extent, for every other person to be safe, because you really can lock people out of your country forever. But now that the United Nations has rejected the call, saying that doing both is possible, what does that mean?
First of all, human beings naturally are selfish, right? And you have to look at it. Israel is not talking about vaccinating its whole population. It's talking about vaccinating its vulnerable population. So it's going to be a percentage of its population. And I think that's what France is looking at, and Germany, and even United States and United Kingdom. So in all fairness, they actually have to look at for their own vulnerable populations also. So what we're trying to do is, and that's one of the reasons why sometimes I get really angst about all this misinformation and disinformation, because there are some areas where you even have vaccine and people not interested in taking the vaccine. We are all in this together. Until a lot of us realize that, we will be in this together. And just vaccinating your own people is not necessarily, I mean, it gives you a better footing. But what if the vaccine wins? We don't know yet. The vaccines have only been available to the general population since December of 2020. The first set of people that were vaccinated in the studies were at the end of April and the beginning of May 2020. And so we have to watch them for 2 years to see how much protection the vaccine gives you going into those 2 years.
All right. So we'll see how these countries, US, UK, Germany, France, and Israel respond in the coming days. And really, if we can do both as claimed by the United Nations. Thank you so much for talking to us, consultant physician and infectious disease specialist, Dr. Getty Chimeka Ayanwoke.
Thank you for having me.